Today we have come to Clear Vision Eye Center and we have Dr. Vinay Agrawal with us, who practices at Clear Vision Eye Center based in Hyderabad, Mumbai. And he is also a visiting consultant at Leelavati Hospital. Dr. Vinay Agrawal is one of the few trained corneal surgeons with special interest in keratoconus management. He is trained with some of the leading specialists around the world and has to his credit several publications in the international and national journals. Today we will discuss with him the various aspects of keratoconus. Hello Dr. Vinay Agrawal. Hi. So please tell us what is keratoconus and what part of the eye is affected in keratoconus.
Keratoconus is a disease which affects the front of the eye, which is the cornea. This cornea is usually the transparent structure in the front of the eye, and when it becomes distorted or the shape gets altered, we call it keratoconus. In simple terms, kerato means cornea and conus means the cone. So it's the conical cornea, as the disease name suggests. It is derived from the word keratos and conus. So that is why it is called keratoconus and affects the front of the eye.
In the front of the eye. And when is it usually present, like keratoconus?
The most common presentation that you would find would be in the second and the third decade of life. The patients would usually be in their teens when they first start noticing that their vision is not as clear as they would like it to be. Blurring of vision is there. Then there could be images which could be in forms of shadows or ghosting of images. Patients would also complain of multiple images, and once there is a progression of this disease, they will feel that the number is changing very rapidly, and even after changing the numbers, they are not able to see very clearly with their glasses. This would be a very important sign for everybody to understand and remember that this could be a presentation of keratoconus, and they need to visit their eye doctor to rule out the presence of this disease.
Since we all know that keratoconus is not a very rare disease, but can be present and affected in both the eyes or only a single eye?
Generally, keratoconus is a disease which affects both the eyes. Fortunately, it does not affect both the eyes together. Usually, you will find one eye gets affected earlier than the other, but over a period of time, both eyes will get affected in almost all patients. There are some reports of only one eye getting affected, but that is very, very uncommon. So, conventionally, we would believe that keratoconus is a bilateral or a disease which affects both eyes in the same patient.
And what usually, according to you, causes keratoconus?
The exact cause of keratoconus is not clearly defined. However, most of us in this field believe that it is developmental in origin. That is, there is a genetic basis due to which certain abnormalities in the growth of the cornea occur, and therefore this cornea gets distorted over a period of time. However, as I said, we don't really know the exact cause of this disease.
And what are the problems in the vision that suggests keratoconus causes as such deterioration?
A patient would generally present with numbers changing very rapidly, unable to see very clearly even after changing glasses. Patient would complain that the quality of vision is not as good as it was before. Patient can complain of ghost images, glaring, and night driving difficulties if the patient is beyond the second decade of life. There could also be multiple ghost images around light as a presenting complaint in many of these patients. However, surprisingly, many of them may not even be aware in the early stages that they have a problem.
Does keratoconus lead to blindness?
This is a myth which I would like to completely deny. I don't think keratoconus can lead to blindness in any patient, regardless of the severity of the disease. Today, with modern scientific techniques and tools, we have ways and means in which these patients can be controlled very well. The disease can be arrested from progressing if the patients come in time. There can be various other options like contact lenses, corneal collagen cross-linking, intracorneal lenses, intracorneal lenses inside the eye, and also that keratoplasty is a time-tested method which is still very viable in these patients. And even when we go in for the the final choice of corneal transplantation, the success rates are in excess of 98%. So to repeat, I do not think any patient in this day and era would go blind because of keratoconus. He or she will need care, yes, but blindness, definitely not.
And so how does this cornicoria especially touch you? How do you diagnose this problem?
The first and foremost thing for keratoconus diagnosis is that the practitioner should be aware of this disease. He should maintain a high index of suspicion. The common things which we look for in these patients, as I have already mentioned to you, are the symptoms. That is, if a number is changing very frequently, then there are some diagnostic tests that we can do. Like there is something known as a retinoscopy which can show scissors reflex. There are other tests, of which now the most widely used is the corneal topography. This is mapping of the surface of the cornea, and there are certain signs and certain methods when we look for in that can tell us very early keratoconus also, because these machines are very sensitive in their ability to pick up this disease.
What is the difference between keratoconus and common astigmatism? What is the number mean?
The difference between astigmatism and keratoconus, astigmatism essentially is a very common number related issue wherein the number is different in the two axes. For example, if you look at an egg, the curvature of the egg is different in one axis and is different in the other. That is regular astigmatism, wherein a patient wears a cylindrical glass and can see well. In keratoconus, the problem is that this astigmatism becomes irregular, and therefore there is no defined point which is common in any area. And this leads the patient to have poor vision even if their correction with glasses is attempted. The only way in which this irregular astigmatism can be overcome is with the use of contact lenses, of which now there is a huge variety which can be individualized to a patient to give him or her the best possible visual correction.
And how do people with keratoconus manage with the problem?
The first thing which I now do with my patients of keratoconus is that if it is a progressive problem, then we need to arrest it. Till about say 10 years ago, there was nothing much we could offer our patients in terms of arresting the disease. But now, with the help of corneal collagen cross-linking, which we've been fortunate to have in our armamentarium in our country quite early, and even our own experience now over the last 5 years suggests that it's a very successful procedure, a very safe procedure, which keeps the disease arrested at whatever time point the patient first presents. So typically, I ask these patients to undergo this procedure, and then as far as managing the disease is concerned, most of my patients manage successfully with contact lenses or with the help of ICL or intracameral lenses. Alternatively, if the patients are very advanced diseases, then we do cornea transplant. But most patients manage very well with glasses or contact lenses after having undergone a corneal collagen cross-linking with riboflavin or C3R as it is known for short.
Okay, one common myth or people generally don't know how to use contact lenses in the Indian scenario.
The important thing to understand is that any technology which you get from wherever needs to be adapted to your environment, to your situation. The common difference between the Western countries and ours is the high presentation of dust and heat in our environment as compared to the temperate for the temporal climate. Therefore, the important thing to understand is that the lenses need to be made in such a way that the patient can successfully use it. Secondly, the patient needs more attention in terms of taking care of their lenses. You need to clean them properly, keep them properly, and also visit the eye care practitioner at regular intervals, whoever is managing your contact lenses, to see if the lenses are behaving properly. So these would be very important tips to use them successfully in our environment.
Dr. Vinay Agrawal, as we all know that cornea is the window to the eye. Then what makes the cornea to be transplanted in a human?
Yeah, as I was telling you earlier, cornea essentially is the front of the eye. It is the transparent section. It is literally speaking the window to the world as far as I am concerned, not only to the eye. Because only when it is transparent and allows light to pass through, can all of us really see this world in its beauty as the good God meant it to be. But then, certain things happen in certain individuals' lives which can cause this transparency to go down. One disease which we discussed was keratoconus. There are other problems in other layers of the cornea wherein the surface of the cornea can get damaged due to disease, due to infection, due to malnourishment, due to injury. All of which can cause this cornea to become opaque or white or lose its transparency in various grades. This is a situation wherein the vision will go down because unless the light reaches the retina, we will not be able to appreciate it. And this generally are the indications which lead a patient to the need of cornea transplantation. At this point, I would take this opportunity to make a big request for eye donation. In our country, there are more than 1 to 2 million people waiting to get a cornea for a transplantation. If everybody in India was to donate their eyes of the next of kin when they die, we could wipe out this list within a year. But presently, India does not more than 15 to 20,000 cornea transplants a year, and therefore there is a huge waiting list. Please consider eye donation as a very important and a supreme donation to help others after you are no more.
Talking about eye donation, what should be the measures taken care, like when an eye needs to be donated? Like everybody, though wanting also, cannot donate an eye. So what are the symptoms that healthy eyes should have to donate an eye?
Here I differ with you. I would say that every one of us can donate our eyes. What is important to understand is that eyes are donated after death. So you and me, even if our intentions are good, would not be able to do it in our own lifetime. So it is important that we do it for our next of kin to be informed that it is my desire that my eyes be donated after my death. The process is very simple. You just need to call up an eye bank. Rest will follow. The eye bank has a standard protocol which gets activated once a call is received. Personnel from the eye bank would come, collect the tissue, take it to the eye bank, process it, standardize it, and then one donation would lead to 2 individuals being able to see the world through your eyes, which would anyway be burnt or destroyed in some other manner, depending on your own belief.
So tell us what are the changes in modern techniques in the scientific world in eye transplantation?
The first and foremost is what we do is cornea transplantation, and it is a procedure which has been around since almost 100 years. It may be of interest to you that the first registered cornea transplantation occurred in 1905, and from there we have worked upwards to try and improve the outcomes of cornea transplantation. Previously, the full thickness of the cornea would be transplanted in a patient, regardless of which layer was diseased. Today, with the changes and improvements in technology, the methods and the instrumentation, we have reached a level where we do transplants depending on the layer of the eye which has been affected. We can change only the front 90% of the eye cornea, or we can change only the inner lining or the corneal endothelium as we call it. And so cellular level is the next step. Layers we have already reached. Today we are in a situation where we can transplant 3 patients from one donation. So that means if I have one cornea received, I can use the upper 90% for one patient, the inner 10% for another patient, and the rim, which would usually go waste in the past, would be used for the third patient. So if we get one donor today, we can actually do 6 eyes, not even 2 as was conventional in the past. Science is improving, but we also need to help by making eye donation a reality.
Thank you, Dr. Vinay Agarwal, for giving us your valuable time.
Thank you. It was a pleasure.
We were talking to Dr. Vinay Agarwal. In addition to teaching at various conferences, he has been a guest editor at the Indian Journal of Ophthalmology and has been awarded for Bell Pharma Award for Best Original Research by Maharashtra Ophthalmic Society, and he is a recipient of Dr. V.K. Chitnis Oration from Maharashtra Ophthalmic Society for his work in keratoconus.